This is Adam Rodman, Clinical Fellow in Global Health at Beth Israel Deaconess Medical Center and host of the medical podcast Bedside Rounds, and you are watching the 2017 Department of Medicine Annual Report. 150 years ago, here in the hills of southern Botswana, the Scottish missionary, physician, and explorer David Livingstone convinced Seychelles I, the chief of the Botswana, to convert to Christianity in that cave. 80 years ago, the Scottish Livingstone Hospital was opened in Molepolole, Botswana, just a few miles away. 2 years ago, I came here as part of the BIDMC Botswana program as an internal medicine resident. It was the hardest thing I had done in my life. Yeah, I was managing diseases that I hadn't read about since medical school. I was drawing all my own bloods, doing new procedures, and I was learning how hard it is to manage medications without a pharmacist. But that was the easy part. The hard part was that I was here in a brand new medical system and culture, and I was expected to mentor and teach Botswanan interns. But it was also the best thing that I had done in residency, and it changed the course of my career. I wasn't even back to the United States yet before I emailed and applied for a job to return to Scottish. And so I returned in 2017 as a BIDMC Clinical Fellow in Global Health. Here on my ward, I teach Botswana interns and medical students as well as American residents from across the globe. The nurses and doctors here are great, and I like to say that we have the best medical ward in all of Botswana. I don't know how true that is, but we sure have a lot of fun. That's not to say there aren't tough days. Botswana is still a low and medium income country with an ongoing HIV epidemic, and the health system faces any number of challenges. So I learned how much I like quality improvement. Along with my colleagues in the emergency room and hospital administration, we've developed a new sepsis algorithm and management program to try to institute early goal-directed therapy on the medical wards. We'll be presenting our results in London in October. It's busy, but that doesn't mean that I don't have time for my hobbies. In my spare time, I host a podcast called Bedside Rounds about medical histories and medical mysteries. And yes, I did do an episode about David Livingstone. And yes, I did drag my wife out to the site of his original mission. That is a picture of his first operating table. And yes, it's a giant rock. I'll be going back to BIDMC in a couple weeks to join the hospital as faculty. So I've been in kind of a contemplative mood. Mostly, I've been wondering, have I really made a difference here? But I think one of my Botswana interns gave me the answer the other week. He'd always been a sportsman, and he said to me, "You know, Dr. Rodman, you are the first attending who's acted as my coach and encouraged me to learn and to be a better doctor." And really, that's how you make a difference in global health, by building one relationship at a time. Okay, that's it for the video. Thanks for spending a few minutes of your day with me. So if you like what you heard and you want more of me, you can listen to my podcast, Bedside Rounds. It's online at www.bedside-rounds.org or on Apple Podcasts or really any of the podcast services. This will be a shocker to you, but I'm also on Twitter at AdamRodmanMD. So come by and say hi. Thanks, guys.